we will hear all that in the upcoming slides. So the compliance requirements to CPD are that on the 1st of February of each year, pharmacists are required to complete their annual declaration. So on this one, you log in on the SAPC website or on the app, and then you go under the CPD system. That is where you can then do the annual declaration. That annual declaration, it has questions related to the competency standards of pharmacists that was approved in 2018, and it is simply asking you if you are performing those acts. And if you are not, then you will choose I never do this. And if you never do that for all of the competency standards, then the system will designate you as a non-practicing pharmacist. But before it does that, it will ask you if that's what you wish to be designated as. And if it is what you want to be designated as, you will then agree. But if it's not so, you will disagree, and then it takes you back. Then you can redo the whole thing and do it in a way that will suit your designation. For those that are practicing, there are two answers. There's where it says I do it some of the time, and or I do it most of the time. So you choose whichever is applicable to you with regards to that particular competency standard. And then the system will then designate you as a practicing pharmacist. And then you accept. And then after you have accepted, you are then required to complete 6 CPD activities for that year. And if it happens that you designate yourself as non-practicing for a certain period, and then you come back to council to say, I had previously designated myself as non-practicing, perhaps for a period of 4 months, but now I want to be back and be a practicing pharmacist. Then your CPD activities requirement will be prorated. Instead of being expected to do 6 CPD activities, then they will be reduced to 4 if you were non-practicing for a period of 4 months, because according to the calculations, you are expected to do 1 CPD activity every second month. So it gets prorated if you were not practicing for a period of time. We do not allow any manual submissions at all. So the CPD activities have to be submitted on the CPD system, which is available on the website and also on the mobile application. Maintaining an electronic portfolio of evidence. We will go into details with regards to evidence later on. But what I need you to note is that council does not expect you to upload your evidence on the system. Please do not upload your evidence, but you can keep your evidence, and whenever council requires it, they will require it in an electronic format. So the annual declaration is done based on the competency standards for pharmacists as approved by council in February of 2018. And these competency standards are divided into 6 domains. The domains do have competency standards, and the competency standards are separated into behavioral statements. The behavioral statements are those that they say what is it that is expected of you as a pharmacist if you say you are competent in that particular domain. There is a next slide where I will explain this in further details. And this annual declaration, as I said earlier on, you are supposed to complete it by the 1st of February of each year. And if you do not do so, CANTEL auto-designates you as a practicing pharmacist until such time that you then log in onto the system and designate yourself. So if you do not complete your annual declaration for the year and maybe you wait until June or July of the year to complete it, you will still be expected to then comply with 6 CPD activities because CANTEL had auto-designated you as a practicing pharmacist. But if you had then completed it for your own personal reasons and designated yourself as non-practicing, it will be a different story altogether. But CANTEL does auto-designate you if you do not designate yourself, and you will be expected to then comply with the CPD requirements. The designations, it's all explained in the regulations relating to continuous professional development. And it is saying that you can designate yourself as either a practicing pharmacist, which is a pharmacist who is providing one or more of the services or performing one or more of the acts pertaining to the scope of practice of a pharmacist. And a non-practicing pharmacist is a registered person who is not providing one, not any, of the services, or who is not performing one or more of the acts pertaining to the scope of practice of a pharmacist. And you may be wondering, if I designate myself as a non-practicing pharmacist, how will CANTEL know if I can just designate myself and still go and work? It is a punishable offense because you will then not be following the regulations of CANTEL. You will also be breaking the code of conduct of a pharmacist. So when the inspectors of CANTEL goes out to inspect pharmacies, they also check if the registered persons that are working in there are in good standing with the South African Pharmacy Council, and CPD requirements is one part of being a good standing pharmacist, a pharmacist in good standing rather. CPD Essentials. So CPD Essentials, here we're going to take a few moments to say to you that all the important stuff are in the CPD guidance document. So please familiarize yourself with the CPD guidance document. That is where you will find the requirements, that is where you will find the assessments, that is where you will find the deferment, and this guidance document will make it easier for you to understand what is required of you. It also has in it the personal development plan, that is the plan that assists you when you need to plan your CPD activities. So the terms to remember are the domain, competency standards, and behavioral statements. The competency standards are divided into an introduction to the domain. That is wherein we explain who is expected to familiarize themselves with that particular domain, who is expected to then do that. So it is very important for you as a pharmacist to then familiarize yourself with the competency standards, because that way you will know which domains you are then expected to say that you are practicing in. So it's divided into competencies and behavioral statements. And the behavioral statements is 3 levels. There is the entry level, intermediate level, and advanced level. And these are not levels in accordance with how long have you qualified as a pharmacist. But these levels in accordance with how long have you been functioning in the particular category of pharmacy. So, for example, if you qualified, let's say, for example, in 2015, and then since then you started working in community pharmacy, which are retail pharmacies, and you have never worked in a hospital pharmacy, manufacturing pharmacy, wholesale pharmacy, or any other category of pharmacy, then you are advanced in that sector. But if you are to move from the community pharmacy to then a wholesale pharmacy, for example, you will get there and you will be entry. So when you choose your behavioral statements, choose them in accordance with your experience in that particular category of pharmacy or experience related to the particular domain you would have chosen. So we do have 6 domains, which is public health, safe and rational use of medicines and medical devices, supply of medicines and medical devices, organization and management skills, professional and personal practice, education, critical and analysis and research. So those are the 6 domains that we do have. And as I've said, this you find in the Competency Standard that was published in 2018. We will then now discuss just one domain so that you can get a clear idea of what we're talking about. So domain number 1 is the public health domain. And this domain applies to pharmacists whose practice include promotion of health and wellness through the provision of health care, information, and education to the public and other members of the healthcare team. So if you choose this domain, then you are then expected to be competent in the following: promotion of health and wellness, medicine information, professional and health advocacy, health economics, epidemic and disaster management, and also primary health care. So when we say that a person has achieved this particular standard, then that person will be able to demonstrate the following behaviors. They will be able to provide advice on health promotion, provide advice on disease prevention and control, provide advice on health lifestyle, participate in public health campaigns. And these behaviors here that I chose are from the first level. So if you are on advanced or you on intermediate, then your behaviors that are expected of you will be different from this one. But also if you follow the guidance that we give to you or under in the guidance document, then you will be able to do your personal development plan and you will be able to then describe which behavioral statements you're going to choose for yourself before you can go ahead and complete your CPD activities. Frequently asked questions. So under this, we have just chosen a few questions that we get asked on different occasions by pharmacists who are saying that I am working. When I submitted my CV, they did actually say that they are looking for a pharmacist, but I feel that I should not be obliged to comply with the CPD requirements because I'm actually not working with patients. I'm not involved in clinical care of patients. So you get a question where pharmacists they say, I work in regulatory and my sole purpose is to develop regulations. Or I'm not directly working with patients. All I do is to research drug interactions and drug usages. or I work for a medical aid. I interact with patients and doctors, but I'm not in the front line. I don't interact with patients on a daily. Or I train pharmacist students, BPharm students. I train pharmacists. I train pharmacy support personnel. Should I still be expected to comply with the CPD requirements? And our answer to all these questions is yes. You are practicing as a pharmacist, and as a result, you are then obliged to comply with the CPD requirements. So the fact here is pharmacy practice is not restricted to the provision of direct clinical care. It includes working in direct non-clinical care relationship with clients, working in management, administration, education, research, advisory, regulatory, or policy development, and any other roles that impact the safe, effective delivery of services in the profession of pharmacy. So your obligation will then to be for you to choose CPD activities that are relevant to your scope of practice, but you are not also required to limit yourself to the scope you are practicing at the moment. You can also do things that interest you. You can learn things that interest you that are related to the pharmacy profession, or you can learn things that will develop you further. The whole aim here is to keep yourself abreast, to keep yourself informed, to be a lifelong learner, and also to uplift the dignity of the profession. So the important question is, how do I learn? What kind of activities can I then use to say these are CPD activities? Do I need to register myself for a short course? Do I need to register myself for a postgraduate course? Do I need to register for a master's in order for me to then comply with the CPD requirements? And we will answer this shortly. But first, let's do the definition of continuous professional development. Continuous professional development is the process by which registered persons maintain and enhance their competence through their professional careers. Encompasses a range of activities, including continuing education and supplementary training. It also enables a person to develop in their area of practice and demonstrate competence. So the whole reason Council introduced CPD was not to punish anybody, but it was simply to uplift the dignity of the profession and make sure that pharmacists develop their competence and are able to then demonstrate it. The CPD submission process, you need to submit 6 CPD activities. We do have 2 different cycles for you to pick from. So we have the 4-step cycle where you then need to plan it first. It's not something you can just easily dive with and complete, otherwise it becomes difficult for you. So it's easier if you then sit and ask yourself, what is it that I need to learn? And after I have decided what is it that I need to learn, how am I going to learn it? Once I have learned it, what am I going to do with the knowledge that I would have then learned? So it you can start the step at any point in time. It consists of the reflection, the planning, evaluation, and implementation, but you can start at any point, but it will not allow you to submit if you did not complete all the 4 steps. And then we have, and sorry, it does on the 4-step cycle, there is no limitation of how many CPD activities you can fill in. You can fill in however much you want, and the system will not stop you. But on the 2-step cycle, you are limited to 3 CPD activities for the year. So only 3 on the 2-step cycle, and then the rest you can do on the 4-step cycle. And the 2-step cycle is one where if you didn't plan this one, but you realize that actually by listening to that or by reading that page, that journal, or by being in that particular class, I've actually learned something that I needed to learn, then you can go and do the 2-step cycle. So this is what the 4-step cycle looks like. It's reflection, planning, evaluation, and implementation, and you can start anywhere. But then before you submit, you need to have made sure that you have completed all the 4 steps. And the 2-step then looks like this. It's only the evaluation and the implementation step. So what constitutes a good CPD activity? A good CPD activity needs to have a learning title, and please make sure that the title is appropriate and relevant to the particular domain that you have chosen, is relevant to the competency that you have chosen, is relevant to the behavioral statement that you have chosen. And it cannot simply be a copy and paste of the domain or the competency or the behavioral statement. It needs to be something that you creatively come with. So a good CPD will need to also have a learning need, which is what knowledge gaps do you seek to fill? What is it that you feel that you need to enhance your skills with? There are learning methods or learning activities, and this I'm going to explain in more details on the next slide. But learning methods, we do have what we call measurable learning methods, and these are those where you enroll yourself for a short course, or you review an article, or you are invited as a guest speaker and you actually do have the evidence for that, then you can use that as your CPD activity. You can enter it on the system. You can use it on more than one occasion, because if it's a short course or if you're preparing yourself to be a guest speaker or you have read an article, depending on what you have learned, you could have learned a variety of things, and you can then fill in your CPD activities more than one CPD activity. And there are non-measurable CPD activities, and this is where it's a self-study or it's a case study, or you have attended a masterclass like this one and you feel you have learned something that deserves to be a CPD activity, then you can go ahead and do that. Then we do have what we call structured learning activities, and these are those courses that are more than 7 months in duration. It could be a diploma or postgraduate studies, it could be a master's, and on those ones, you can then select which domain that particular one is related to, and then you can fill in your CPD activity. So a good CPD activity also needs to have a learning outcome. What have I learned from this? How did it improve my skills? So this is what constitutes a good CPD activity. And then these are the learning activities that I was describing earlier on, that it can be either a self-study, it can be a case study, it can be a conference attendance, can be postgraduate studies or short courses. And you can use that as your CPD activities. And what you can then keep as evidence will be the article you have read, will be the certificates you acquire, and it could also, if you had developed standard operating procedures after you have learned your lessons and filled in your knowledge gaps, then you can use the SOPs that you have developed as your evidence. If perhaps you needed to find a root cause and develop a CAPA, you can use that, the procedures and the guidelines that you develop, you can use those as part of your evidence. But please, please, please note, do not upload your evidence on the CPD system. So what is a portfolio of evidence? A portfolio of evidence is documents that you have used to learn, or that you have acquired when you were learning, or that you have developed when you were learning. And those need to be current, they need to be valid, they need to be relevant to the domain that you are doing. So if we are in the year 2021, you then cannot be using evidence that you have acquired in 2020. So your evidence need to be relevant for the current year for it to be valid. So the CPD entries, as I was saying, they need to relate to the learning of the current year. And the evidence can be any documents, as I have said, but please, please do not upload your evidence. So it will be wrong for you to then use evidence that you have collected in 2019 for 2021 or for 2020. You need to make sure that your evidence is for the current year. And then we have received a lot of queries. People are saying, I've entered my CPD activities during the grace period, but they are not showing under 2020, and I was not compliant with my 2020 requirements yet. So please do not worry about that. They will be showing under 2021 because they show according to the date. But Council will take 6 of that and count them towards compliance for 2020 if you were not compliant in 2020. So there is no need for you to worry and send us emails to verify if you comply for 2020 or not. So how you check how many CPD activities does Council have from you on the system, you go under annual declaration, then it will show you. Like for this one, it is showing that for the year 2020, this person had complete 26 CPD activities. And what we have done is we took all these 26 CPD activities and put them under archives. The sole purpose of this was to make sure that we create a way for 2021 CPD activities to avoid confusion, so that then the person can start on a clean slate and do their 2021 CPD activities. And this person in particular had already submitted for compliance 10 CPD activities for 2021. So what we will do on the 1 minute past 12 on the 1st of May of 2021, we will take 6 CPD. If you did not submit any CPD activities in 2020, but you were supposed to, and you only submit them now in 2021, On the 1st of May, we will take 6 CPD activities and make them count towards compliance for 2020. And then whatever rest is left will then count towards 2021. So please, there's no need for you to worry. Do not panic. Council did receive your CPD activities. If you have already archived them, please do not restore them, because that will just cause further confusion on the system. Leave them there. We have counted them. You will see your numbers will show here under the entries. So the highlights, these are the important points to pick from the presentation, is that Council system does not work on CPD points at all. We need for you to learn and then come and demonstrate what you have learned by putting it in words on the CPD system. We do not allow third-party entries. Please do your own entries, because your login details are confidential. The Council system is confidential to you. It contains your confidential information. Council will not be assessing CPD for pharmacists for competence. We will only be assessing you for compliance at the moment. It might change. It's a pipeline dream to change it. It's a pipeline plan to change it to assessing you for competence, but at the moment, we only assessing for compliance. Non-practicing pharmacists are not allowed to practice any of the acts relating to the scope of practice of a pharmacist. So please, if you have designated yourself as non-practicing, just make sure that you do not practice as a pharmacist. And also, Council encourages lifelong learning, and please make sure that you become a lifelong learner so that you can uplift the dignity of the profession. We have developed the registration app, and this is a mobile application that is available on iOS, it's available on the Play Store, it's available on the Huawei App Gallery. So please install it. It's very important that you do so, because in it contains the digital registration card. Council will not be printing physical registration cards anymore. So that is the card that when inspectors of councils come to the pharmacy and they request you to identify yourself, they will then request of you to log in on your mobile app and show them your digital card. Please upload your pictures there, upload identity document size pictures that are visible and that shows the person is clearly yourself, and also amend your personal details, your cell phone numbers, your address, your email addresses, so that council can be able to contact you at all times. And most importantly, this app does contain in it the CPD system, and it allows for you to use that system to then enter your CPD activities. So thank you very much. I've reached the end of the presentation of the slide. So what I will do, we have received questions from you when you were enrolling to come for this masterclass. So we have selected a few questions that we feel that they are perhaps not answered clearly in the presentation that we made. We tried to answer clearly all the questions in the presentation. So I'm going to take you through these questions, and once I'm done, I will then open the floor for discussion and questions. So the question here is, if I'm registered in July, Do I still have to complete 6 entries for the year? I think I've answered this in my presentation. I did say that if you are registered at any point in time, council will then prorate your CPD requirements. So as I've said that you are required to complete 1 CPD every second month, if you register in July, you will then be required to complete 3 CPD activities and not 6. Must CPD relate specifically to pharmacy? On this one, I'll say please familiarize yourself with the competency standards and make sure that the CPD activities that you do are related to the competency standards. In the competency standard, council made sure that they encompass all the categories of pharmacy to make sure that the standards suits everyone. Can I capture my CPD entry in Word and then transfer it onto the website? Well, we will not know that you had previously captured it on Word. So this one is not an issue for us. What we want is for your CPD activities to be there. But what you need to know is that you will not be able to upload a Word document on the CPD system. You will need to follow the steps in order for you to complete your CPD activity. Is CPD compulsory for assistants? At the moment, not. Council is in the process of developing competency standards for pharmacy support personnel, and it is currently at the stage in which that document will go to council in the next May council, and then after that it will be published for comment. So please be on the lookout for it and then comment on it, and then council will receive your comments and then they will review the comments, and then after that the document that will be published after the comment period will then be the final document that will be published for implementation. And once that is done, then council will publish a board notice that will then notify all the pharmacist assistants that they are now required to comply with the CPD requirements. So until such time, then it will not be a requirement for them to do so. Must I complete 6 entries if I have been unemployed for the last year? I think I've answered this one, so I'll skip it. What is the process to apply for extension, condonation of CPD requirements, for example, due to ill health? In the guidance documents, we do have the deferment process. And the deferment process does state that a person can then be approved for deferment for a period not exceeding 12 months. So when you apply for deferment, you can do so and address your request to the office of the registrar, and your request will be taken to the CPD committee, which will review it, and you will get a response as to whether you are deferred or not, and what are the conditions of such a deferment. But yes, such a process is available for you. When are CPDs due? CPD activities are due on the 31st of December of each year. That is the deadline in which you are supposed to have complied with your CPD requirements. But if you do not do so, council provides a grace period which ends on the 30th of April of the subsequent year. So you do have a grace period of about 4 months that allows you to then comply with the CPD requirements. Thank you very much. I'm going to open the floor for questions.
Raisibe. Okay, there is a question on the chat box, which I think maybe you can answer it.
Okay, please mute yourself. I'll answer it. What if it is a 5 months repeat prescription that was written in December 2020 and the patient came for their repeat in 2021? Is this considered as current? It will definitely be considered as current if you're going to dispense that prescription in 2021. If I submit 3 CPDs in April and submit 3 in June, will I be able to write my exam if I'm... Oh, I think this one is an intern. And Tavam, please respond to that one, reply on the chat box to that one. Okay, I will take hands. Please forgive me if I pronounce your names wrongly. Don, please ask your questions. After that, we will go to Jackie.
Hi. I did an ARV program last year. Is that still valid if we work on that program? Seeing it should have been done by the end of December 2020.
That is valid if you do not yet comply with the 2020 CPD activities. So you can use that for your 2020 CPD activities.
But so surely that would be relevant still, because we actually should have completed this the end of 2020.
Yes, I am saying if the CPD activities that you will be entering are the 2020 for the 2020 compliance, you can then use the evidence that you acquired in 2020.
No, I was compliant in 2020. Can you hear me?
Yes.
Because this is actually 2020 that we're working on still, we're in the grace period. I thought that would still be valid.
The grace period is for those that did not comply with their 2020 CPD requirements.
I'm confused then. Okay, so
let me ask a question to be sure that we are understanding each other. So you are saying in 2020 you have completed 6 CPD activities and you do comply for the year?
Yes.
And you are asking if you can then use evidence that you acquired in 2020 for 2021?
Yes, because we've only been through 4 months of 2021. You know, it was a course that we did toward the end of last year. And so I thought that would still be applicable for this current year.
So it's a course that you have done in December?
No, it wasn't December, but it was toward, I think it was about August, September. I think it was September. You know, it was quite an intensive course that we did. So I thought that would still be applicable for our CPDs now that we're preparing.
No, that would have been applicable for the 2020 CPD activities.
Okay, all right. Thank you.
Thank you, ma'am. Jackie, please ask your question.
Very much. I just have two questions. I think I was just a little bit late in joining. Just navigating to the annual declaration. I think there might have been a glitch on the website because I went on the dashboard under annual declaration and I didn't see a space to navigate to actually declare my declaration or click on it, the space. And the second question is just the value of having the peer review, or why basically why are there the peer reviews on the option for CPDs? I have got two peers that will review them, but I just wanted to know, is it just adding extra admin to them, or is there actually value going forward in the CPDs to have them peer reviewed?
Thank you for your question. Firstly, I'll answer the one about your annual declaration. It was possibly a system glitch, but if it still does persist, please send us a query so that we can forward it to the IT department and they can see what's going on. And then with regards to the peer review, it is not just an admin step, and also it is voluntary. But the whole purpose of the peer reviewer is so that they can help you understand your CPD activities better. They can review what you have entered so that the both of you can have a discussion to check if you're on the right path, and it's an opportunity for you to learn from each other. So that is the whole purpose that it's there. But it is not compulsory. And also what the system does is when you send your CPD activities for peer review, it becomes a parallel process. One comes to us for compliance, and then one goes to the peer reviewer. So you do not get penalized if your peer reviewer does not get a chance to review your entry.
That makes sense. Thank you very much. I'll double check the annual declaration. And then does that peer reviewer count towards, again, as a parallel or an aligned CPD process as well? I mean, could you CPD a peer review, basically? I know it's a complicated question, but...
Yes, we have had incidences where if you had submitted something and then your peer goes and put in comments and you want to improve your CPD activity based on the comments from your peer reviewer, then that becomes another CPD activity for you. So you don't go back and edit what you had previously entered, but you can go and put in a new activity based on the improvement after you had a discussion with your peer reviewer.
Perfect. I understand. That's great. Thank you so much for the concise answers. I just have one last question that's coming up here a couple of times. How do we know that we weren't compliant if we weren't compliant in 2020?
If you were not compliant, if you did not complete 6 CPD activities in 2020, then you know that you were not compliant. So if you had completed 6 CPD activities by the 31st of December of 2020, then you were compliant.
Okay, perfect. Thank you very much. And thank you for the very insightful and concise presentation. Very appreciated.
It's my pleasure. Thank you. Ms. Dunn, I see your hand is still up. Do you have a follow-up question before we go to Kim? Kim, please ask your question.
Hi, thank you. Evening, everybody. So my question really goes around CPD programs and so forth that are offered by, service providers, de novo, EM guidance, to the like, where you do a, you read an article, you do some questions, and you actually go through the process as you would as a, a doctor on the HPC SA where there's accreditation. Is there any, path where you could potentially go that route and, upload a, not a certificate, but somehow merge a HPCSA accredited CPD with the SAPC CPD process? Or is that something that could potentially still be developed in the future?
It will not be developed. I have mentioned previously that our CPD system does not work on points. So what is expected of you is that you go learn and then you come back and reflect on what you have learned. You demonstrate what you have learned on the CPD system. So we are not, you cannot just present a certificate to say, I've learned this, I've learned that, I've learned that. You need to actually log in on the system and then reflect on what you have learned.
Thank you.
Thank you.
Hi, Raisa. Yeah, on the chat box, one is saying we didn't really give them more information on the two-step cycle. May you please just take them through as well. They're saying what info was given on the 4-step, but not the 2-step.
Okay, let me display again. There was possibly a misunderstanding, perhaps, because I did talk about the 2-step cycle and I did show it here. This is the 2-step cycle. And I did say that on the 2-step cycle, you are only allowed a maximum 3 entries per year on the 2-step cycle. And it is only the evaluation and the implementation step. And this one requires no prior planning, because it's something that you can learn perhaps in the middle of a training that you are already in, or if you were attending a seminar, you can realize that this is something I didn't know and I'm actually learning it now, and you can use that as your CPD activity. And there is also a YouTube tutorial. Thank you, Madimeta. There is a YouTube tutorial that takes you on the step-by-step of how to complete the 2-step cycle. 6 minutes, ne? Thank you. And I see there is a question that's saying, what if the article you have read is for self-interest only and does not have any impact in your workplace? I guess in that case, you will then not enter it as a CPD activity, because we did say that CPD activities are linked to the competency standards. What is the name of the app? The name of the app is SAPC registration. SAPC registration. That's the name of the mobile application. Okay, JK, I see you're saying, will that not be self-development domain 6 self-interest article? It could be, but the person's question was saying What if the article you have read is for self-interest only? So I was answering based on what the question was saying. And hence I'm saying that if it's related to the competency standards, you can then enter it as a CPD activity. And then there's a question from YouTube that's saying, when moderator says no clear learning plan, what are they looking for? Taban, please answer this question. This is related to internship.
Okay, thanks, Raisibe. Yes, like you indicated that only the intern CPDs are being moderated, assessed, and they go for moderation. So usually the moderators will comment and the assessors. It's hard for us to can give a clear explanation of what they mean, but our moderators, they can be contacted in case you need to be clarified on something. You can always inform the office, and then we will connect you with the moderators. Thank you.
Thank you, Taban. Let me see if we have hands. Lexa, please ask your question.
Good evening. I just want to ask, on the app, I'm able to change my personal details and so, but not my employment details. On that, it still shows my internship of 15 years ago. So I did also send an email, but still, I didn't get any response. So I'm not sure how to rectify that.
Please give me your P number in the comment box, or you can email it to me, and then we will change your employment details. Unfortunately, that you can't change by yourself. We need to change it in the office.
Thank you. I'll do that.
Thank you. Okay, so I see there's a hand. I see the hand, but I cannot see who has raised it. So please unmute yourself and ask your question.
Hi, Raisibe. I just have one question. If we had to, for example, submit 10 CPDs last year for 2020, does the extra 4 from last year go on to the 2021 submissions? Or do we have to do a whole 6 new submissions for 2021?
Unfortunately, there is no carry forward with regard to CPD activities, since they need to remain current. And we do have people that have done about 41. I think the maximum we have is 44, but we will not distribute that for the upcoming years. They only count towards the year in which they were completed, and you are expected to continue each year and comply with the CPD requirements.
Great. Thank you very much, Raisibe.
Thank you. Let me check the chat box.
Okay, there is a question from Asanda. She wants to know if the pharmacy CPDs are being assessed. I think maybe she missed it, since well you indicated that they only submit for the purpose of compliance. Only the intense CPDs are being assessed. I think she just needed that clarity there.
Thank you, Tabang. Asanda, they do not get assessed for competence, but we assess them only for compliance. We need to make sure that you submitted 6 CPD and that they are relevant and for the current year, but we don't assign assessors to mark those. And then I see there's a question from YouTube that is saying, can SAPC articles be used as part of CPD? Definitely, yes, they can be used, because you will be learning, and if it's relevant to you and if you have learned something there, by all means, please use it. What if it was oh, that one we have done it. Let me see.
Raisibe, let me attempt to this one. There is a question about 3 CPDs being submitted in April and then other 3 in June. And the person wants to know if he will be able to sit for the exam. The answer is yes, but with CPDs, remember, you don't just submit. There are deadlines or the dates on which you expected to have submitted. So if you have submitted outside the deadline, that will be a disadvantage on your side. So interns must just familiarize themselves with the deadline dates. They are clearly indicated in the manual, but the requirement is for you to be competent in 3 CPDs, although you should have submitted 6. Thank you.
Thank you, Thabang. Will this presentation be available at a later stage? Yes, it will be, and also it's being recorded on Facebook and on YouTube as well. So the recording of this session will be available on those platforms as well. Are there any further questions, suggestions, anything at all you would like to discuss? Colleagues, thank you very, very much for attending this session. We really appreciate your time that you took out of your busy schedules to come and spend the evening with us. We really hope that you have learned something. We learned a lot from you as well. Thank you so much. We can then adjourn this training.
Thank you.
Thank you.
Thank you.
Thank you.